eruption pattern for the primary and the permanent dentition. So for primary dentition, the first tooth to erupt is your mandibular central incisor, and this erupts at the age of 8 months. Okay, and the last tooth to erupt is about 29 months, and that is your maxillary second molar. So when you come to the permanent dentition, the first tooth to erupt into the oral cavity is your mandibular first molar, and this happens at the age of 6 years. And the last tooth to erupt into the oral cavity, among the permanent teeth, is your mandibular and your maxillary third molars, and they erupt at the age of 17 to 21 years. I hope this is clear. Let's move on further. What are the most common terminologies that we use in dentistry? So you have your facial surfaces, lingual, based on which surface we are referring to. You will have various surfaces that we look at. You have your facial surface, lingual surface, palatal, mesial, distal, incisal, and occlusal surface. So when you say facial surface, it is that portion of the tooth which is towards the patient's face. So facial, you could further divide into the labial surface and your buccal surface. So the labial surface is mainly for the anterior teeth, because the tooth surface that faces towards the lips, and buccal surface is mainly for the posterior teeth, wherein the teeth face towards, or the surface of the tooth that faces towards the cheek. Right? When you look at the lingual surface is that portion of the tooth that is towards the surface of the tongue. Similarly, for the palatal surface, it is that surface of the tooth which is towards the palate in your maxillary arch. When you say mesial surface, anything that is close to the midline will be your mesial surface. When you say distal surface, anything that is away from the midline will be your distal surface. So what is your incisal surface? So now incisal surface is, in case of incisors, the functional edge of an anterior tooth is what is called as an incisal surface. Whereas for posteriors, it is called as an occlusal surface. So the functional edge of a posterior tooth is what is called as an occlusal surface. We'll look at the model and then I'll show you or demonstrate the surfaces in a model. So now this is your maxillary jaw and this is your mandibular jaw. So embedded here are your the permanent set of teeth. So this is your central incisor. This becomes your maxillary lateral. This is your canine, first premolar, second premolar, first molar, and the second molar. Now similarly for your lower teeth, you have your central, lateral, canine, first premolar, second premolar, first molar, and your second molar. So let's understand the surfaces of the teeth here. Now when you say this entire surface of this is called as your facial surface because it is towards your patient's face. For the anterior teeth, you call it as your labial surface because it is towards the lips, and for your posterior teeth, you call this as your buccal surface because it is towards your cheek. Now that is similar even for your lower teeth. Now when you see the inner surface of your maxillary jaw, since it is covered internally, you have your palate. So this entire surface will be called as your palatal surface of the tooth. And for mandibular, since the tongue falls in place here, you call this as your lingual surfaces of your tooth. Now when you draw a midline, when you draw a midline here, so surface which is closer to the midline of that particular tooth becomes your mesial surface, and the surface which is away from your midline becomes your distal surface. When you look at the functional edge for anteriors, this is your incisal edge, okay, for all your anterior teeth, and for posterior teeth, this becomes your occlusal surface. Let's move on to understand the parts of a tooth. Now what you're seeing here is an anterior tooth. So now you can divide the tooth into two parts. That is your crown and your root portion of your tooth. When you look at a posterior tooth, you'll have to remember that posterior teeth are multi-rooted teeth. They'll have two roots, but if you see your anterior teeth, they are single-rooted tooth. Like some of the anterior tooth do have two roots, but that is in a rare situation. But posterior teeth are multi-rooted teeth. So premolars have two roots, so bifurcated, and molars usually have three roots, especially your maxillary molars. Mandibular molars have two roots. So here you can divide your tooth again into crown, and then this entire component is your root. So now here further you can divide your root into the root trunk. So this constitutes your root trunk, while this is your root cone. And this point that you're seeing here is what is called as your furcation. So either you can have bifurcation or trifurcation. Bifurcation is seen in tooth which have two roots, and tooth which has three roots, you can call it as a trifurcation. Now this furcation area is very important when we look at the pathological aspects of the diseases or the diseases that affect your periodontium or tooth supporting structures, which we will discuss in our further sessions. With this basic understanding of parts of teeth, let's go a little bit more detail into the on the occlusal surfaces. So there are some certain grooves or pits which are present within the occlusal surface of a tooth, which are called as your pits and fissures, and which are of very crucial importance or clinical significance in terms of the oral hygiene or in terms of any pathological processes that happen to the tooth, which include your dental caries. So they act as sources of entrapment. The deeper they are, they enable or they shelter the microorganisms in them. So now this, what you're seeing, is the occlusal surface. So the points here that are marked, they constitute your pits. So these are developmental in nature, and these are your fissures. So together you can call them pits and fissures. Now they're usually seen on your molars, premolars. Let's move on to the tooth and its supporting structures. You can divide the tooth or the composition. You could have enamel, dentine, pulp, cementum, alveolar bone, periodontal ligament, and gingiva. So now enamel, dentine, and pulp we will discuss in one component. Cementum, alveolar bone, periodontal ligament, and gingiva will be discussed in the further section because they constitute your periodontium or the supporting structures of the tooth. So you can see here, so we divide the tooth into two components. You have your crown, you have your root. Now when you look at the crown portion of the tooth, that is the one which is exposed into the oral cavity and is seen through the naked eyes, and the root portion is embedded deep into the bone, covered by your gums. So now this constitutes your enamel, and this is the next layer is your dentine. The red layer here is your pulp, and you have your cementum. So now let's discuss each in detail. First, let's look at enamel. Now, enamel is the hardest structure in the human body. It is harder than bone because of the highest mineral content in the enamel. Now, it is white or gray in color, and it is mainly translucent. So it is important, very important for the aesthetics. So the aesthetics that comes is mainly from your enamel. Then the outermost covering of the tooth crown, and it originates from the ectoderm. Now, what are the cells that contribute to the enamel formation? These are your ameloblasts. Now, enamel is non-vital, and it has no regenerative capacity because ameloblasts, after they lay down the enamel, they do not survive or they die. So there is no other cell that produces these enamel, and that's why enamel has no regenerative capacity. So once it's lost because of any pathological mechanism, it is lost. Enamel contains what are called as enamel rods when you see it under an electron microscope, and the thickness of enamel is about 2 to 3 millimeters. The enamel is composed of the inorganic content, which includes your 94 to 95% formed by your hydroxyapatite and other minerals. The organic component is just about 1 to 2%, which includes your glycoproteins and proteoglycans. and then water constitutes about 4% of enamel, and that's why it is the hardest structure in the human body, much harder than bone, cementum, and dentine. Let's move on to the second layer of the tooth, which is your dentine. The dentine, as I told, is the second layer, and it is the largest. It forms the largest bulk of the tooth because it continues from the crown into the radicular portion, that is your root portion of the tooth. So dentine is softer than enamel, but it is harder than bone and cementum, and this is because the mineral component is much less than enamel, but it is higher than bone and cementum. And the dentine is derived from mesoderm. Okay, and the cells that lay down dentine are your odontoblasts. Okay, the color of the dentine is usually yellow and it is more opaque, but if you see enamel, it is white and it is translucent. So dentine is much yellow in color and it is opaque in nature. The thickness ranges from 3 to 3.5 millimeters. Now let's look at the composition of dentine. Again, it's composed of an inorganic component, which is mainly your hydroxyapatite, which constitutes 75% of dentine. You have your organic content, which contributes to 20%, mainly composed of collagen fibers. And then you have your water and other minerals constituting to 5% of your dentine. Let's see into detail on the microscopic anatomy of dentine. So now dentine is mainly composed of what are called as your dentinal tubules, and they are S-shaped in nature. Okay, and inside the dentinal tubule you have something called as an odontoblastic process. These are nothing but your extensions of odontoblasts, which are the outer or the peripheral most layer of your pulp. So these processes extend. These are cell processes that extend into the from the pulp into the dentinal tubules. Now this dentine is filled with something called as your dentinal fluid. Apart from the odontoblastic process, you have your dentinal fluid within your dentinal tubules. Now the dentine, usually towards the pulp, there are the number of tubules increase in number. So the largest number of tubules are present at your pulp, approximately about 45,000 in number, ranging to 60,000 tubules are present near the pulp. So now let's see the pulp. Now what is pulp? Now pulp is the only connective tissue and it is the only vital tissue of the teeth. It is mainly composed of water, which is 75%, and then you have your organic content, which constitutes the rest 25% of pulp. The organic content includes your collagen fibers, your ground substance, again that is your proteoglycans, and your glycoproteins. Then you have your cells or blood vessels and nerves within the pulp. So pulp is richly vascular and it has its nerve fibers embedded in it, and it is the only vital tissue of the tooth. So now what you see, when you see now under a microscope, the pulp can be divided, or it has basically 4 layers. As I told, the peripheral layer is your odontoblastic layer. Then you have your cell-free zone. So you have the odontoblastic layer here, which throws out processes which extend into your dentinal tubules. And then you have a cell-free zone. And then you have a cell-rich zone, wherein you have a lot of cells, which include your fibroblasts, okay, and your undifferentiated mesenchymal cells. And then you have your pulpal core, which is richly filled with blood vessels and nerve fibers. Okay, now here in the cell-free zone, again you have ground substance, okay, and then you have your connective tissue components, which is richly vascular, again the vascular tissues, and your nerve fibers. So this pulp core is the one which forms your central area of the pulp. Now let's see the functions of pulp. What is the importance of pulp? So it has formative function because it helps in the formation of dentine. So dentine usually forms not just during the development of the tooth, but it also forms later in life. So basically it keeps forming. So this comes from your pulp. So the pulp tissue has odontoblasts, which are the dentine forming cells. The other functions of the pulp is your nutritive function because it supplies nutrients to the dentine. And you have your sensory functions. The pulp, since it has nerve fibers within it, it has the when it receives some stimulus, it can respond to pain, cold, and even air. So basically thermal stimulus, it can also respond to heat. Okay, the main nerve fibers which are embedded into the pulpal tissue are your A and C type of nerve fibers, and largely it is your C fibers that constitute your pulp, followed by your A delta fibers. Now let's move on to the next component, that is your tooth supporting structures, which is your periodontium. So the tooth supporting structures together constitutes your periodontium. So periodontium is comprised of hard tissue and your soft tissues. The two soft tissues of your periodontium is your periodontal ligament and your gingiva, while the two hard tissues is your cementum and your alveolar bone. Now let's see a little more detail into each tooth supporting structures. Now you can see in the diagram here, I have tried to depict where is the gingiva, where is the alveolar bone, where is the periodontal ligament and the cementum. So now this outermost covering, what you're seeing is your gingiva, and then this is your alveolar bone, this is your periodontal ligament. Okay, this is your alveolar bone, this is your periodontal ligament, and this is the cementum, which is the outermost covering of your root. Let's delve more detail into each of the tooth supporting structures. First is your cementum. Now cementum covers the radicular portion of dentine. It is a hard tissue formed from cementoblasts. So cementoblasts are the cells that form your cementum. The color is usually light yellow in color. It is softer than dentine because of the less amount of inorganic component within the cementum. It is avascular structure. It is the avascular, alymphatic, and it is not innervated by nerve endings. But this layer, that is the cementum, it forms continuously throughout life. Let's move on to understand what is the composition of cementum. So you have 45 to 50% is constituted by hydroxyapatite, and the organic content and water constitute to 50 to 55% of cementum. And this mainly comprises of type 1 and type 3 collagen. Type 1 about 90% and type 3 is about 5%. Let's look at the types of cementum. Now the cementum is classified based upon whether it has cells or it does not have cells. You can also divide it according to the location of the cementum, whether it is in the coronal portion of the root or in the apical portion of the root. So you have your acellular cementum. By name, it means that it is that part of the cementum which has no cells in it, embedded in it, but the cellular cementum has cells in it, which include your cementoblasts. Let me rewrite this. Cementocytes and cementoblasts. Okay. The acellular cementum is seen in the coronal portion of your coronal third of the root. The cellular cementum is seen in the apical third of the root. So again, you have two types based on the location, coronal and apical. Coronal cementum is usually 16 to 60 micrometers in thickness, whereas the apical cementum is about 150 to 200 micrometers in thickness. But most important thing that we should know, that the thickness increases with age by almost 3 folds. So at 11 to 70 versus greater than 70, it has been noticed that the cementum has increased in thickness by about 3 times. Now let's see the types of CEJ. Now why we need to know the CEJ? What is CEJ? CEJ is cemento-enamel junction. So it is, we know that the crown portion of the tooth, the outermost covering is the enamel. For the root, it is your cementum. So when the joining point of your enamel with that of your cementum is what is called your cemento-enamel junction. So there have been 3 types of junctions that have been noticed. One is your overlapping junction, you have your butt joint, and you have your gap junction. The overlapping junction constitutes, or it is seen in about 60 to 65% of cases. The butt joint is seen in about 30% of cases, and gap junction is seen in about 5 to 10% of cases. Now let's move on to the other component or the other hard tissue component of your periodontium, which is your